As usual, I will start with the latest numbers on COVID-19 in Canada. There are now 50,373 confirmed cases, including 2,904 deaths. To date, labs across Canada have tested over 758,000 people for COVID-19, with about 7% of these testing positive. Yesterday, we had an update on the progress that Canadians have made in flattening the curve of COVID-19. We also looked at some of the short-term predictions from our real data forecasting models. Things are looking better, though we're not entirely out of the woods yet. We have to remain mindful that our projections are only as reliable as our actions, now and going forward. If we maintain measures that keep the growth rate down and prevent a rebound, we stand the best chance of remaining on this favorable trajectory. With these promising signs, we are increasingly hearing of reopening plans, but this won't happen at the same time or in the same way everywhere. We've seen that the epidemiological picture in Canada, with slowed growth and bending of the epidemic curve, is actually a composite of very different regional outbreaks and different drivers of COVID-19 spread, depending on where you are in the country. Some areas are seeing very few or no recent cases and have started their gradual social and economic reopening. At the same time, all areas of the country know that there is still a need for key public health practices, like physical distancing when we are out or in the workplace and good hand washing, always. The ability to maintain these preventive practices is an important part of reopening plans for workplaces, schools, and businesses. The critical public health capacity that must be in place and maintained across Canada is necessary to ensure adequate testing to detect alerts and respond quickly to any new disease activity. Local, provincial, and territorial level plans for reopening are key to managing this next phase. These plans are based on public health criteria and balance the effectiveness of public health measures against their potential negative consequences. Likewise, these measures will need to remain flexible and adaptable to alerts and signals. Although we will be living with COVID-19 for the foreseeable future, we also know that together we can keep this virus at bay by remaining vigilant. Our collective efforts have already slowed the growth of COVID-19, bent the curve, and enabled our health system to cope. These are no small feats, and they tell us we will get through this. Ça va bien aller. Thank you. Merci.